Assalamualaikum warahmatullahi wabarakatuh. Ma'am Puput as our lecturer and all of friends in the class Nursing A. Thank you very much for attention. For today, I want to present about assessment of urinary system. The urinary system is a system that works as a process of blood filtering or filtration, so that the blood is free from substances that are not longer used by the body, or excretion, and absorb substances that are still used by the body, or reabsorption. Substances that are not used by the body dissolve in water and are excreted in the water form of urine. The urinary system can be said to be the body's cooperation system that aims for internal balance or hemostasis. However, the main function of the urinary system is blood plasma filtration, excretion of unused substance, and reabsorption of used substance by the body. Before we get into the topic, we must know about anatomy and physiology. The urinary system consists of 4 points. First, the kidney, which function to remove urine secretion. Second, ureter, which carry urine from the kidney to the bladder. Third, the bladder, which acts as a reservoir. And the last, urethra, which function to remove urine from the bladder. Anamnesis is an interview with a client aimed at early detection of disease. The client may suffer with a systemic process of collecting data or information about the client, including the client's strengths and weaknesses. Data collection from client, we say autoanamnesa, while alloanamnesa is data collected from other people, like from family, close people, and society. A systemic history includes the main complaint of patient, current medical history, past medical history, family medical history, social health history, medication history, and the last, perceptual cognitive pattern. Physical examination consists of inspection, palpation, percussion, and auscultation. First, inspection, that is, see and evaluate patient visually and is the oldest method to use assess. Inspection on the urinary system include the general state of urinary system, the state of urinary system, vocalisis, and use of assistive devices such as condom catheter, Foley catheter, silicone catheter, or urostomy or suprapubic catheter. Second, palpation, that is touching or feeling by hand, palpation of individual structure, both on the surface and in the body cavity, especially in the abdomen, will provide information about the position, size, shape, consistency, and mobility or movement of the anatomical component, as well as to assess the state of the fluid in the body space. The three types of palpation are light, medium, and deep palpation. The third percussion is examination with pat the surface body lightly and sharply to determine the position, size, density of the structure or the fluid or air beneath it. If a structure passes more air, will produce a louder, lower, and longer sound. More structure solid, which produce a softer, taller, and shorter sound. And the last, auscultation is a skill to hear body sound in the lung, heart, blood vessel, and the inside or abdominal viscera. On examination of the urinary system, some abnormal sounds that may be found are breath sounds, which are an indication of renal artery stenosis. Physical examination of the patient include an examination patient general condition and urological examination. Kidney examination. The presence of enlargement of the waist or upper abdomen area must be considered when inspecting this area. This enlargement can be caused by hydronephrosis or a tumor in the nephroperitoneal area. Palpation is done manually with two hands. The left hand is placed at the corner of the costovertebra to lift the kidney up, while the right hand feels the kidney from the front. Percussion, which is the kidney knock examination, is done by giving a knock at the costovertebral angle. Examination of jar. Buli-buli examination should pay attention to the presence of lump and scar tissue from the incision. Surgery in the suprasymphysis. The mass in the area can be a malignant buli-buli tumor or bulb that is completely filled with urinary retention. With palpation and percussion, the upper limit of the bulb can be determined. Examination of external genitalia. On examination of external genitalia, it was noted that there were penile abnormalities such as micropenis, macropenis, hydrospadias, chordae, epispadia, stenosis of external urethra, meatus, phimosis, fistula urethra cutaneous, and penile tumor. Severe anterior urethral structure can result in fibrosis of the corpus spongium palpable and palpation, lateral to the penis, hard tissue known as spongiofibrosis. Examination of the scrotum and its contents. Note the enlargement of the scrotum, a feeling of pain when touches, or the presence of hypoplasia of the scrotal skin, which is often found in cryptorchidism, to distinguish between a solid mass and gastric mass in the scrotal contents. A transillumination examination of the scrotal contents can be performed. Plug in the rectum or rectal toucher. Digital rectal examination involves inserting the index finger into the rectal opening. On this examination, assess first anal sphincter tone and bulbocavernous reflex or BCR. Second, the presence of mass in the rectal lumen, and the last, assessing the prostate. Assessment of the bulbocavernous reflex is assessed by sensing the presence of any clamp reflex on the finger due to pain stimulation given to the gland penis. In the women who are married, vaginal plugs can also be done to assess the possibility of abnormalities in the female genitalia, such as masses in the cervix, blood in the vagina, and masses in the bladder. Neurological examination is aimed at looking for the possibility of neurological disorders resulting in abnormalities in the urological system, such as motor neuron lesions of peripheral nerve lesions, which are the cause of bully neurogen. Too many kinds of diagnostic examination in urological system. There are laboratory like urine and blood, and radiology like ultrasound, X-ray examination, and other imaging, intravenous urolography, retrograde mammography, infusion drip papillography, cystogram, system program, and renal angiography. That's all from me. Thank you very much for listening. I would like to apologize if there are mistakes. I hope you have a nice day.